y'all have all been, I've only been with one group, but so far those 3 ladies did a good job at using a hugger pillow, which we want to do. And we're not using the arms to push up from the bed when sitting up and when going from sitting to standing. Those are not the only precautions for a Cabg, okay? So for the sternal precautions, we have no pushing and pulling. So that can be pushing down on a walker. It can be no pushing from the bed to move from supine to sitting. It can be no pushing from the bed or chair to stand up. We also don't want excessive overhead motions. No opening the chest real wide because that will stress the sternum where it's trying to heal together, okay, because it is wired under there, but any kind of compressions or overstretching can risk pulling that apart, okay? So I have Christina lying down here, so we're gonna just go through the scenario and how to help the patient sit up and then stand up, and then just briefly do the gait training portion. Okay, so if we're here, if they have a hospital bed or a bed at home, whatever facility you're in, if you're at home or in hospital, and they have the electric bed that'll help raise them up, great, use that. The less work that the patient's gonna have to do or to avoid straining the sternum, the better, okay? So if in that case, you use the bed, it would sit them on up, right? And then they could just swing their legs over, okay? If we don't have that, if we don't have that, I always instruct my patients in helping me as much as they can while avoiding, you don't want to dig the elbows into the bed because again, that's a lot of excessive stress here on the sternum. But I instruct them to help me as much as they can, but then I'm gonna come in behind the shoulders and help sit them up, okay? So this bed is a little bit low, but I would get in here with good body mechanics and help her sit up, and then we would swing our legs over, right? So you just kind of get the patient like we would in any other transfer where they would need assistance to sit up, okay? We just don't want to really squeeze the patient really tight where it's putting a lot of pressure and causing their chest to, or their shoulders to round inward because that's a lot of pressure on the chest as well. So just be careful in helping them up, okay? So then go ahead and swing your legs over here. Can I use that walker? Okay. So, a lot of times we'll come home from the hospital with those little heart pillows, that you see from the cardiac centers. If they don't have them, you can just get any other pillow for them to have a hugger pillow, okay? They don't have to have a pillow. You could have them cross their arms, but then if their arms are not holding something, patients are real quick to release them and push themselves up, right? But if they have this pillow, they're focused on not dropping it, right? So they're keeping that pillow hugged. Okay, so from here, I don't have a gate belt. We're gonna pretend we have a gate belt. Y'all are not gonna pretend, I'm pretending. So it doesn't matter for a Cabg, they may have a weaker side just from past injuries. You can assess that when you're there with the patient. We're gonna assume that she doesn't have any other injuries, one leg's not weaker than the other. I'm just guarding her from this side because I feel more comfortable so I can face all of y'all. So I would get the gate belt here and I would assist her in standing. So you're gonna push through your legs. We're not gonna use your arms at all to stand up. You're gonna keep hugging that pillow. I'm gonna grab your gate belt and I'm gonna assist you in standing up. Is that okay? Once we stand up, we're gonna let go of this pillow and we're gonna grab onto this walker. Okay? On the count of 3, 1, 2, 3. Push through those legs. Good. Keep this one. Grab that walker. Okay, now that we're holding onto our walker, we're not gonna push a lot of weight through our hands because we don't wanna stress that sternum. Okay? So you want to just kind of cue the patient like that. Now, you can, like Dr. Roker has mentioned before, elevate the walker a little bit. So it might be a little bit too high for their actual size, but that'll prevent them from really leaning over and bearing weight through their arms, right? So we want to advise them, we're not going to bend over, we're not going to push a lot of weight through our arms. If we need to use a walker, it's just for a little bit of support, okay, when we're walking. Now, because she's a Cabg, again, you can assess each patient's going to be a little bit different. She doesn't have any issues with her lower body. We're just going to instruct them in a normal walking gait pattern, which is a reciprocal gait pattern. One foot passes the other foot, okay? If they feel a little bit unsteady, a little bit of weakness after their Cabg, you You may notice that they're doing that step 2 gait pattern just because they're a little bit unsure of themselves. If they're seeming to do okay, then you can instruct them into the reciprocal gait pattern, right? So we want to get, with any patient, we want to get back to a normal walking pattern as quick as we can. Okay, so I'm going to have you just turn away from here. Good. Okay, so do we feel comfortable with walking? Have you had any imbalance? Are you feeling dizzy after standing up? Okay, so we're just going to walk across the room, one foot after the other, turn legs past each other as we're walking. Good. Okay, to make this turn. Sometimes I even help. You see me grabbing the walker. I kind of help if you're not really sure if the patient's going to keep their balance when they're turning. I sometimes assist. Okay, and that's just about all with the Cabg. Just instructing them in the sternal precautions, and then as they're getting up, making sure they're not having any dizziness because they did have a cardiac surgery. Assessing the weakness that they might have from going from hospital to home, or if you're in the hospital, they might still be really weak. And just seeing how they're doing with their balance upon standing so that you know how to instruct them with their walking. But the big goal is to just get back to a normal walking pattern. They're probably not going to have any kind of weight-bearing restrictions on the legs following Cabg. Okay? Sounds a little bit easier in getting into a normal walking pattern. Afterwards, it's just the sternal precautions are the big thing.